Right, hello everyone. We're live. I'll give it a few minutes for people to come on.
Brilliant.
We currently have zero listeners, so we'll give it a bit of time.
Yeah, it normally takes a few minutes, doesn't it, for people to realise something's happening and the reminders pop up.
Oh, one listener. Hello, the one listener. Woo! Oh, 4. Okay, numbers are building. We're just going to give it a minute or two, guys, just to give people a chance to join on. But thank you to those that are here already. We have a love heart react already. Great times. Cool. Right, so welcome everybody. My name's Hattie, and we're joined by Nathalie Dowgray this evening, who is all things feline, and she is a vet. I will let her do a little intro to herself.
Yeah, should I go ahead?
Yeah, go for it.
So yes, I'm Nathalie Dowgray. I'm a vet. I've been graduated over 20 years now, but for the last probably over 10 years, I've worked mainly with cats, a lot of work in rescue centres, shelter medicine, and then in 2016 I sort of stopped full-time work and became a full-time student again, and did my PhD at Liverpool University in feline ageing. And then since 2020, I've been working for the charity International Cat Care as part of their veterinary division, ISFM, while still carrying on very part-time at Liverpool with our old cat project as well. So feline osteoarthritis is definitely a subject that I'm really interested in and very passionate about.
Yeah, perfect. So Nathalie is the perfect vet for the job, having done, all of that stuff over many years, and dedicated like a huge chunk of her career to all things cats, especially aging cats. So definitely very relevant to what we'll be chatting about tonight. So we are focusing, this is our first talk of Feline Arthritis Month, which is very exciting, a new kind of topic, going off dogs for a month, but don't worry, dog people, we'll be back. But we're going to be talking about improving awareness and diagnosis of feline osteoarthritis tonight. So I will do a little mention, guys, that we are now doing Facebook stars, which is where you guys can, I believe you have to purchase the stars. There's a little thing about it you might see in the comments box, that you purchase stars, you can give stars to Cam, and we can then do stuff with that. And the aim is that we're going to try to build a Cam app. So if you so wish, any stars would be much appreciated. The benefit to you guys is that any questions or comments you make get boosted to the top of our questions and comments list, so we will see them and respond to them. So just a little shout out for the stars there. So we'll get cracking now. So can Nathalie, if we could kind of get an idea of the prevalence of osteoarthritis in cats, because you often, or we hear it quoted that 80% of dogs over 8 will have some degree of arthritis, but where do you think we're at with cats?
We're probably at least a similar level. We have a couple of really big studies that were X-ray studies, radiographic studies, and they showed a variance between 61% up to 92%. And they were looking at cats across quite a wide variety of ages. So the study that showed 92% was looking at cats aged from sort of 6 to 12 months all the way through into over 20 years. And the second study was looking at cats over 6. I think the really key take-home point is that X-ray studies aren't necessarily what the animal is feeling and experiencing and what it's impacting in terms of their ability, in the cat's case, to climb, to jump, to do their catty things. But it gives us a really good hallmark that actually if the disease is there in the joint, we have to assume that there's probably an increased likelihood of some pain that's then going to be impacting on the animal. So it is very, very common. One of those studies did a follow-up one, and it's a statistic that I find really useful to quote, and that showed that for every year a cat got older, their risk of having osteoarthritis increased by about 13%. So I think when we think about our cats as they're aging as well, maybe our young adult cats, there might be some changes in their joint on an x-ray, but maybe it's not really impacting them. But in 5-10 years' time, potentially that's when we're going to really start to notice the signs of disease. We're going to be having that pain and that reduced mobility that's going to have a really, really big impact on them. So literally as they get older, every year we need to be starting to thinking more about osteoarthritis with our cats.
Yeah. So those study with the radiographs, I guess, like you say, it's difficult to always correlate findings on radiographs to how the cat is actually feeling and perceiving those changes. But it's it's good to know about it, isn't it? So that those owners can be extra aware that their cat will probably at some point start being clinically affected.
Yeah, I think that's it. The PhD work that I did, we didn't have funding in that project or the ability to do x-rays on the cats. So we were relying on just a very thorough physical examination and orthopedic examination. So observing the cats moving, palpating and manipulating their joints and looking for any obvious thickening or sort of crunchy movements, crepitus when we're examining them, any signs that they were painful. And just in a middle-aged group of cats, so cats aged between 7 to 10 years of age, we had over 50% of them had something happening on that examination that made me think we need to be keeping an eye on your joints as you get older. Mm-hmm. So yeah, I think if you look for osteoarthritis in cats, you will find it.
Yeah. So let's start from basics. What are the common signs of osteoarthritis in cats?
So this is the thing that probably makes cats a little bit different from dogs. In dogs, often we're out there working, out there walking with them every day, where we're taking them on often a regular routine and seeing their physical movement during that time. And during that time, things like lamenesses are more likely to come up. You're more likely to observe that the dog's walking more slowly. Whereas our cats are very independent. They are doing their own thing around the house. We're not necessarily having that same degree of physical interaction with them every day. And cats are very, very good at managing any pain themselves just by thinking and adapting. And so there's some really subtle behavioural changes that we need to be starting to look out for. And they're things like how well the cat is jumping up and down off surfaces. And what we need to be doing is not comparing that to last week or last year, but probably 3 to 4 years ago, thinking about how they were when they were a youngster and thinking about what's changed over that longer period of time, because they are slow and subtle. And so things like the jumping up, I'm currently standing at my desk. I've got a standing desk, and one of my cats can jump very smoothly from the ground up onto this desk. I say smoothly, if he does it, there'll be a loud thunking noise. He's not the most graceful, but he can get up here on his own. My other cat, unfortunately, does have osteoarthritis already, despite the fact that he's very young. He's got some developmental conditions that make him more prone to it, unfortunately. And he's never been able to make big jumps like that. So he takes a little staircase up onto the windowsill, and then he comes over onto the desk that way. So for him, that's normal for him, and it was part of one of the reasons why I now have him on pain relief. But if the other cat starts to do that kind of behaviour, that to me is a real trigger that something's going on with him, because I know now as a 4-year-old cat, he's able to make that jump really smoothly. So there's really subtle things like that. Again, how well they're jumping down off surfaces. Are they making a smooth, large jump down, or are they looking for something else like a chair to jump down on first and then come down onto the floor? We also want to be looking at play behaviour as well. So happy, comfortable cats can be quite playful, and people seem to think that play behaviour decreases as they get older, but it doesn't. So we need to be looking for that too, still encouraging them to be playing as well. And then we learn to look at how comfortable they're sleeping, how well they're getting up and down from resting positions. We know cats like to form little loaves or nice little round balls when they're asleep, especially in winter. If a leg is starting to stick out or they're starting to look really awkward and getting into their little comfortable posies, again, that's another sign as well. And watching their normal sort of stretching and grooming behavior especially as well. So cats are very good at keeping all of their body clean. And if they're starting to get areas where it's starting to get a little bit kind of greasy, a little bit more hair clumps together, starting to maybe get some mats, again, that's a sign that they're not comfortable reaching that area, and pain's definitely one of the ones that you're looking for on that. So the signs are there, but you've just got to pay attention and maybe a little bit more and really reflect on what's changed over their lifespan rather than just what's changing compared to last week, last month.
Fine. So it's sort of quite long-term changes often.
It is,
I suppose, like getting owners to really think back years rather than just kind of days or weeks. Really,
it is. It's often very gradual. I mean, there are some circumstances where it may happen a lot more quickly. And again, it's just thinking about things that might have happened in your cat's life as well. So cats that maybe as a young cat had an accident, maybe a road traffic accident, may have, ended up quite beaten up from that. They may have fractured something. Any kind of history of trauma like that as well. It's sometimes those are the cats that we should be probably watching even more closely than just our average cats as well, because they're going to be slightly higher risk too.
Yeah. And what would you say are the most common joints to be affected?
All of them, sadly. So that is one of the joys of cats. When they get osteoarthritis, it's often symmetrical and it's often multiple joints. So again, when we look back at some of those radiographic papers, they are showing slightly higher prevalence in some joints over others, but really we're talking about hip joints, we're talking about stifle joints, we're talking about the elbow joints, we're talking about the shoulder joints, but also we're seeing them in the carpal and the tarpal joints. If you look hard enough, you'll probably see it in the digits as well. And then we do get a lot of osteoarthritis is an interesting term in the sense that it really refers very specifically to joint disease and joint inflammation. When you read literature, veterinary literature from America especially, they're often talking about degenerative joint disease, which includes osteoarthritis, but also includes other age-related changes around the joints. I personally often end up talking about musculoskeletal disease because we're talking about osteoarthritis, we're talking about these degenerative changes, but often there's other changes to the muscles, to the tendons, that are also impacting their mobility. They're also causing pain. And cats, when you think about them, they're very flexible in their spines. You know, they're up climbing trees, they're jumping down. And again, we do see a lot of sort of spinal changes as well that, again, are leading to sort of chronic painful conditions. So sometimes they are affecting a joint and what we truly call osteoarthritis, but often they're just more degenerative joint changes that are going on there as well. So again, that paper that showed that 13% increase with every year of age, what was increasing as well was the severity of the disease in the joints and the number of joints affected as well. So it might start with maybe some knee arthritis at 8 or 9, and then by the time they're 12, 13, you've got multiple joints, unfortunately.
Yeah. And do you find sort of difficulties retracting their claws and things like that?
Yeah, you definitely start to see that as well. And so again, that can be associated with joint pain. Again, they're not performing some of those grooming behaviors as well. That was something I found really interesting with my own cat when I started him on pain relief. He's never been very good at using a scratching post. He uses it, but he was never really digging his claws in. And 3-4 weeks after he'd started on his pain relief and things had really sort of settled down, he was properly stretching up and really scratching down with his claws. So thickened nails in older cats are a really good thing to be looking out for from those of us on the vet side, but also for owners as well. If historically you've never needed to trim your cat's nails and at sort of 9-10 years of age you're starting to need to, osteoarthritis is definitely one of the conditions on the list that we need to be looking at. And you get a bit more, if you've got wooden floors, you get tapping of the claws on the floors, which you normally don't hear with a cat because they're normally tucked up nicely and they pad. But if you start to hear tap, tap, tap with your cat, that's a pretty good sign too.
Yeah, cool. Yeah. can see in the comments that Ruth has commented saying that she's currently working through a feline fear, anxiety and aggression course, and wondering how we might differentiate pain from other issues such as these, and that, you know, feline body language and facial expressions are more difficult to work out than dogs. And do you have any guidance on differentiating the two?
Yeah, that one is a really tricky one, because in terms of the behavioural responses that we're seeing, the underlying emotional states of sort of fear, anxiety, pain is also one of those underlying emotional states that is going to lead to that repertoire of behavioural responses that we're looking for. It is tricky, definitely acute pain in cats. I'm a really big fan of the feline grimace scale, and that has actually now been validated. Originally it was validated for us in the veterinary professional side of things, but it's also now been validated for owners as well to be able to use that. So that's a really nice one for acute pain. But when we're talking about osteoarthritis especially, we are talking about chronic pain. So I have to say I'm quite a big fan of a pain relief trial with these patients. And definitely if you're dealing with older cats, arthritis sadly is just one of the problems they often have. So when we're talking about older cats, we're talking about arthritis, we're talking about dental disease, they're at increased risk of kidney disease, hypothyroidism, diabetes. There's lots of things that may require them to need to come into the veterinary clinic on a regular basis. And with those ones, if I'm treating their osteoarthritis with pain relief, I'll often try and tweak their medication schedule so I know that they've got a good level of analgesia on board before I start examining them. I find, again, on the physical examination side and the assessment of the cat in the clinic with osteoarthritis, especially with these fearful and anxious cats, which a lot of them are in the vet clinic, it's harder to feel very confident about your diagnosis in that situation. So that's when owner videos from home are so useful, because then you're really being able to observe how the cat's moving and interacting in their home environment, an environment they feel nice and safe in. And I find those really helpful on top of whatever I can manage to do during that sort of clinical side of things.
Cool. Yeah. So that's something that owners can come to us kind of armed with videos and evidence and things that we can kind of review with them. Because I think it can be difficult, at least I find it difficult sometimes with cats in a consult room that might be a bit fearful anyway. And same with dogs as well. And actually seeing them in their kind of usual environment is very helpful.
Yeah, definitely, because you know, the vet clinic is a strange foreign place, so even the most confident of dogs can sometimes feel a little bit anxious in there as well. And my day job is with the International Society of Feline Medicine, and we run a program called Catfriendly Clinic to help vet clinics to kind of start to adapt their environment as much as we can to improve the situation for cats. You know, unfortunately, we're probably never, with some cats, fully able to relieve the fear and anxiety, but we can make really small changes that can have a massive impact on that. So if people are interested in learning more, we have a website. It's just catfriendlyclinic.org. So do have a look at that. There's resources both for the veterinary professionals, but also for cat owners as well.
Yeah, I think all the sort of cat-friendly clinic interventions are really good, because it's, well, everyone wins really. Obviously, you know, great for cats. It means, you know, the vet can get more out of the examination with a less stressed cat, and it's
That's it. A stressed cat doesn't give you results you can be confident in. So the more happier they are, the more confident you can feel with your diagnosis, which is always a good thing.
Yeah. We've just had another question come in from Bonnie. Are there different things to look for if a cat was declawed?
Definitely. So fortunately, in the UK, declawing is illegal, which is great. So it's not a common thing that we see, which I'm very happy about. But there are some reports that we are seeing increased numbers of declawed cats coming into the UK. And unfortunately, it still remains very common in other parts of the world. With declawed cats, obviously, with the actual procedure itself, with declawing, there is the risk of chronic pain occurring as a result of that procedure. So there's a few papers out there showing that some of these cats, because of remnants of bone in their feet can be living with chronic pain. So it's not arthritis, but it's chronically painful for them. Ones that fortunately don't have that, and the procedure has not led to that complication, we'd still be expecting pretty much all of the other behaviours if osteoarthritis is occurring. Again, things like the jumping behaviours, the grooming behaviours, they're all going to start to change. So the only thing you won't see with those is the thickening of the claws, really. You would still potentially, you can still get digital arthritis in those cats, even though the final digit has been removed. You can still get arthritis in the other digits. It may not be as apparent because the procedure itself stops them from performing that very natural scratching behaviour.
Cool. Yeah. How do you think that if an owner is concerned that their cat's showing signs? I mean, we've kind of already touched on it by saying, you can take videos and things like that, bring it into your vet. But how do you think? I suppose both ways. How do you think owners can start that conversation with their vet, and how can vets start that conversation with owners who perhaps are a bit less aware of what might be going on with their cat?
Yeah, so I think I'll start with the veterinary side, because I think we can do an awful lot to raise awareness and start young, because what we want to be having people understand is what's normal for the cat when they don't have arthritis, because every cat's different. They're all living in different environments. There's very strong differences between cats that are indoor only compared to cats that have a large territorial range outside, cats that have to climb over fences to get to their range compared to cats that only climb up windowsills and onto the top of wardrobes. So it's understanding what's normal for the cat when they're a young cat, and exploring their environment to its fullest, and getting them aware that arthritis is really common in cats, and just starting to think about it as they get older. And we found that worked really well at the Feline Healthy Aging Clinic at Liverpool, because from sort of 7 years of age, we were examining and assessing these cats and making noises about arthritis. And so actually and having the owners fill in the questionnaire regularly. And so they were starting to think about these questions that they were being asked every year, and paying a lot more attention when some of those changes started to occur. And we can really mimic that in the vet clinic. I'm a massive fan of the Feline Musculoskeletal Pain Index questionnaire. It's a really nice, it's been very well developed over the years, and I think it's now sort of 9-10 questions long. So it's really short, and it's encompassing all of those behaviours that I was mentioning earlier. And just having every cat owner fill that in once a year as part of their annual examination is getting the awareness raised with the owner, but also giving the vet some information to be able to track over time. So I think that's really helpful. From the owner's side, if you're noticing some of these changes and you're thinking, ooh, it's possibly osteoarthritis, definitely calling your vets and making an appointment, making sure you say to the receptionist or the client care person that's answering the phone, you're concerned it's osteoarthritis, because hopefully that will encourage them to book a slightly longer appointment as well, because we do need some time to assess these cats. It's not something you can fit in a really short 5-10 minute appointment at the end of the day. It's definitely best if you can to do it with a little bit more time. I find that one really, really useful, to have a bit more time with them. And collect those videos, bring them in. If you're able to, and your vet clinic is happy using one of these questionnaire type tools, filling that in as well is really useful. I can just see some people in the forum asking about where they find it. I've got the website here. I saved it on purpose. So let me see if I can put it in the chat box.
It was like she knew.
Yeah, I know. Well, I knew I'd mention it. I'm not sure if I'm able to add anything to the chat box, but its website is just painfreecats.org, and you're able to access the questionnaire through there. So it's a really, really useful one to use.
See if I can. It will let me type in the chat.
Awesome.
So I'll see if I can find it. Oh yeah, painfreecats.org.
Yeah, that's it. It's a useful website. Again, it's also got owner information as well as information for vets as well. I have my slightly special cat signed up to it, so I regularly assess him and see how he's doing. There's actually another sort of tool that other of my colleagues really like as well. And it's something called client-specific outcome measures, which is a bit fancy, but essentially you reflect back on 3 things that your cat used to do very well and they're no longer able to do. And then when we're going through the treatment and management process of the osteoarthritis, we're really looking for that improvement over time with those things. So if it was, they like to play for 20 minutes every evening, you want to try and get them back to that kind of level of activity.
And Natalie, the Catfriendly clinic is, I've just found it, catfriendlyclinic.org. Is that the one
That's the one
you mentioned earlier? I'll just pop that in the chat as well, because we've got somebody asking.
Yeah, no, there's lots of resources on there. The process itself is partly designed to optimize the physical environment of the clinic, so to make it as cat friendly as possible. But then it's also us as vets, how we are handling and interacting with the cats, and also from the owner side of things. It's things like getting your cat into the basket to bring them to the vets. It's really hard work, I have to say, now that I'm no longer working in practice and I have to take my own cats to the vets rather than just shuffle them off to work with me. It's very stressful and it's very hard getting 2 cats I have 2 baskets, but to take them to the vets at the same time, it gets my heart rate and blood pressure up every time.
Yeah, definitely. Let alone their blood pressures. Yeah, I imagine as well, if a cat's arthritic, then even just trying to get an arthritic, painful cat into a box as well is not going to be a great experience for that cat. That's
it. Often, especially if it used a smaller cat carrier with them, often when they get arthritic, they do need a larger one because they can't form those little cat bundles the way they used to. Their limbs don't sort of contract as well. So there are sort of things like that do definitely help too. What I try to do with mine, I have the baskets out all the time down in the lounge, sort of slightly tucked away so they're not too obvious, but at least one of the cats likes to use it as a little sort of hidey hole sleeping place, which means he feels more comfortable in it. Unfortunately, he's now learnt that when I put the door back on it, that signals bad things. So I need to start some kind of training program to undo that part. But despite the fact that I work with amazing behaviourists, I'm not very good at. I listen to their advice. I'm just not so good at acting on this.
Yeah,
but I will try.
I personally love when owners bring me their cat in those lovely carriers where you can take the whole lid off nice and easily. There's no like dragging the cat out of the basket. We try and not do that and not have to, so if you are a cat owner listening, then have a look at your basket and see if it is one where you can easily take the lid off. Great. If not, might be a worthy investment, especially if you've got a nervous or older cat, probably for any cat, to be honest.
They do make our lives so much easier. I have a strong dread of those round wicker baskets with the hole that's only about that big, because if a cat doesn't want to come out of those, there's nothing you can do. They
can cling on with every little hole.
And it's distressing for all of us with those ones. So the ones that you can take the top off and then you can put a towel and things over. I do a lot of my examining of cats while they're still sitting in the base of the basket, because it gives them that sense of security around them.
Yeah.
So they are really useful. I mean, obviously, if the cat's very confident and will just strut out as soon as you open the door, brilliant. But it's always nice to have that option of being able to take the basket sort of apart if you need to.
Yeah, definitely. Wow, you guys are making my job very easy this evening, because every time I think about moving on to another topic, someone posts a question. So Barbara has commented to say about, would you say that changing the home environment will help prevention of OA in cats in the same way as in dogs, like adding rugs, etc.? Or
yes,
or not?
Definitely. So not necessarily for prevention, but definitely for helping them cope. So when we think about cats, they live in a 3-dimensional environment a lot more than dogs. They go up a lot. And so moving furniture around to allow them access to higher places is really useful. And again, rugs, possibly less so. We see less of those sort of slipping issues that we do with dogs on sort of wooden floors and things, but it's still important to consider if there's a part of the house where the cat does take a lot of sort of foot traffic through. Definitely our more disabled cats with osteoarthritis can skid a lot more. So things that I tend to recommend is it's thinking about, again, how your cat was X number of years ago and what they like to do, because they all have their own little preferences. But in my case with my cat, for every windowsill in the house, I've got some kind of little step or piece of furniture that he can climb up on to then get to the windowsill, so he can still stare at the birds and do whatever he wants to do looking out the window. By radiators, I make sure I've got radiator beds or just soft beds, because he really does like the warmth. He seeks out the warmth, so he likes that. And then likewise, even with his little cat door, I have a little mini step up, so he can go up in 2 steps rather than one large step, because as well as his other issues, he's got quite short legs, so that helps as well. So all of those things that you can do are really, really useful. What we don't fully know yet is what causes arthritis in cats. So we know there's associations with trauma. Obviously, infections in joints can lead to osteoarthritis. We have a few breeds that have high predispositions to them. So the best known of those is the Scottish Fold, to have those little curled up ears. That is a cartilage disorder. So it's something that's been bred solely for looks that leads to exceedingly crippling arthritis in them. So as cute as they look, we should not be breeding those cats. We have a question mark around, there's a breed called the Curl, the American Curl, that has quite soft ear cartilage. We don't know if it leads to an increased risk of osteoarthritis, but definitely breeders report that the ears are more fragile and easily bruised. So again, it's cartilage, so potentially that one is also a risk. And then large breeds of cats, so things like the Maine Coon, are predisposed to conditions like hip dysplasia, which in turn increases their risk. We also see a really, really close relationship between weight and osteoarthritis in cats. There's a little bit of a chicken and egg question over that. Are they heavier? And that's that more physical load on their joints, which is exacerbating and increasing what we see in terms of the osteoarthritis. But obesity is also an inflammatory condition. And so that actually might be also in turn causing the arthritis. But definitely in other work as well as my own work, we've seen that we're seeing these changes on physical exam and orthopedic assessment are more common in our heavier cats. So if you can, trying to, cats get middle-aged spread the same way we do. So they tend to reach their sort of peak obesity, as it were, and that's sort of late middle age, early senior years, so sort of between 8 and 11, 12. So we really want to try and avoid that. We want to try and keep them at a nice steady weight. And then as they get even older, they're more prone to losing muscle mass as well. So if we can keep their muscle mass and their muscle strength up, that's going to also help their mobility. So there was a question in there about exercises, and we can't really exercise cats in quite the same way we do in dogs, but we can encourage them to play, encourage them to be active. I've seen some examples of people that create like little obstacle courses to keep the cat moving around. So things like that are really useful. Again, with my cat, I found now that he's on his pain relief, he's a lot more playful. So we try and do some controlled play each evening, again, just to keep his activity levels up and hopefully just keep some of that muscle strength up as well.
Cool. Lovely. Now, yeah, we've covered a lot of the things I'd planned to talk about. So sort of, lifestyle factors that would make them more prone to osteoarthritis. Oh yeah, are there any kind of inappropriate types of exercise or play that we should be avoiding?
That one is a tricky one. I tend to be very sort of cat-led with it. So if they have osteoarthritis, it's kind of trying to just work out what's suitable for them. So it's not kind of like dogs, because in dogs you can kind of have some rules, especially with young growing dogs, and making sure you're not putting a lot of high impact type exercise while their joints are still developing. We don't really know that for cats, I'm afraid. So generally I kind of watch how they like to play and adapt things to that. So my cat that doesn't have arthritis, I use the wand toy and a lot of air action. He jumps and he spins and he leaps around. The other one that has arthritis, I tend to do a lot more on the ground. So he's doing a lot more movement, but he's not doing that leaping and the twisting, because don't know, rightly or wrongly, I'm trying to avoid some of that impact landing type exercise with him. We do also have to be careful, I think, when we're considering our cats that go outside as they get osteoarthritis, because a lot of, in the UK with cats that go outside, a lot of us have some degree of fencing in our gardens. And again, historically, when these cats were young and fit and healthy, it wasn't a problem to get over the fence and off down the road to do their business, to go and see the neighbours, to use the toilet in the neighbour's garden. So those kind of activities, they may be harder for them to do. So we do need to make sure that we're giving them all the resources they need that are easily accessible for them. So if they like to toilet outside, making sure that in your garden you've got an appropriate place for them to go to the toilet. I'm a little bit grumpy at the moment because someone is digging up my spring bulbs, but it's a nice garden bed to use. So I just wish they were using the empty garden bed, not the one with the spring bulbs. But it's making sure you're providing them litter trays inside. Again, it's thinking about how they used to live and can they still access those resources as well. So we definitely need to be thinking about things like that.
Yeah, cool, definitely. So Bonnie has asked, are there any cat towers or furniture geared towards senior cats?
Not any that I've seen specifically that are marketed for senior cats. I find cat towels and furniture always really interesting. I struggle to find stuff that's big enough for one of my cat, and I don't think he's a particularly large cat. But definitely when I was looking at buying, you can kind of see it behind me. There was a cat tree behind me, and I purchased that one specifically with quite low levels because it also acts as stairs for my cat to be able to get up on this funny little landing thing in my office that I have stairs going down, so there's sort of a boxed in place, which is perfect for a cat hangout place. And so I made sure that this was low enough that it had the sort of stair levels for him to be able to get up to. Some of them are adaptable, but some of them aren't. So generally I would look at what they are, and then if you think there's a gap that's a bit too big for a senior cat, maybe there's something like a stool that you could also put to the side to just give them that extra stair so they can still access the levels. A lot of it is really, because it is so individual to the individual cat, it's really trying to look at how they're interacting in their environment and then what adaptations you need to make for that individual.
Someone needs to make a business of like custom-made cat towers.
Ones that you could adjust the heights would be amazing, I have to say.
Yeah.
That would be, it would just be useful because then you could just adapt them as the cats get older. You can change the levels, but also when they're kittens you need lower levels, and then you're happy with bigger levels. Otherwise you end up buying new stuff more often than you really need to.
Yeah, I'm sure someone that's good at DIY could make some cool, adaptable ones.
Yeah, I have to say I've had a good time just using things like IKEA stools around the house. So things like that are surprisingly useful.
Nice. So like it doesn't necessarily have to be that fancy. It's just like you say about kind of assessing the individual cat's kind of capabilities and providing appropriate ways in which they can access those higher levels and
and watching, seeing what they do, seeing what works. If it doesn't work, try something else as well. So it's like everything with cats. You can do the most amazing thing and the cat will just look at you and go and sit in the box that you came with it. So it's definitely sometimes you have to sort of watch what they're doing and then tweak things.
Yeah, cool. I think we've touched on it a little bit, but kind of the psychological effects of chronic pain on cats, and how you would recognize that.
And again, it is tricky. Definitely, like most species, I think chronic pain leads to depressive type behaviours. People will say it's anthropomorphic for us to say that, but again, they're mammals like we are, so why wouldn't they experience things the same way we do in that sense? So with cats, that can be really tricky because they are very independent. They often naturally sleep a lot anyway. So a lot of these things that you would associate are often increased sleeping, slightly maybe decreased eating, decreased interactions with family members. It's hard because some cats are naturally quite standoffish and very independent, and so there may not ever have been a high level of that sort of behaviour. what is interesting with some of, especially with older cats, is they do, there's a couple of nice studies that have really sort of shown you do see an increase in infection type behaviors with people as they get older. So they often become more interactive with us. They'll be seeking out resources from us, so heat and warmth and comfort. And so you may see an increase and then a decrease in those behaviors as they become more painful. So it is tricky to look out for. Again, it comes back to where you can, knowing your own cat, knowing their own personality, and looking to see what those changes are. The most important thing is not to sort of dismiss them as they're just getting older, because it's easy to, we all know cats sleep a lot, and as they get older, they're going to sleep more. But actually, a lot of those things that we kind of assumed were natural for them as they got older were probably just because we weren't recognizing a lot of these underlying diseases. Osteoarthritis in cats I always find really interesting, because some of the first x-ray studies came out about the time I was at vet school. So for cats, it's a new disease. It's kind of not, because it's always been there. It's just, there was for quite a long period of time a sort of assumption that cats didn't really get arthritis. Dogs did, but cats didn't really. So we're sort of a bit behind in that sense. And I think because we don't interact with cats in quite the same way, it can be very hard to miss some of those signs. So you are looking for really subtle sort of signs. So increased sleeping, decreased interaction with people or other pets that they used to like to interact with. You often see more aggressive behaviors or grumpy. They're old and grumpy. But actually part of that is because they're sore and they no longer enjoy you patting them because it hurts. So we're looking for those ones as well. And appetite decrease. It's often very subtle. They're often still eating, but they're not eating as much. And then you do start to get a little bit of gradual weight loss as well.
Yeah, and I suppose cats hopefully probably are living longer as well, as we're getting better at treating. I mean, you're the expert on this, as we're hopefully getting better at recognizing and treating all the other kind of old cat conditions as well.
We definitely, and we again, new diseases. Hypothyroidism is a relatively new disease, so there's a lot of things that we're doing a far better job at the earlier intervention. So again, when I went through vet school 20 years ago, anything over 10 was considered a geriatric cat. Now we're seeing sort of super senior cats at 16, 17 that if you didn't have their full medical record with their age on it, you wouldn't quite believe that they're that old. So they are definitely living longer. But with that, again, we do see more osteoarthritis, and we also see more kidney disease as well, because they're the kind of parts of the cat that start to wear out first, I always sort of think about, which does make the management of osteoarthritis perhaps a little bit trickier in terms of managing their medication, because a lot of these cats will have other concurrent conditions going on, and it is a little bit of a balancing act.
Yeah, definitely. I'll just have a little look at some questions that have come in. So Sophie says, I have a yard cat. He's currently only 2 years old, very active, lives in the tack room, but climbs up and over the stable wall into the stable next door to get in and out. As he gets older, how can I help him be able to get in and out? I would say a mounting block or a bag of shavings.
Yep, like to be honest, hay bales stacked up. So really anything that provides a surface that's solid and firm enough for the cat to feel confident to jump on it. They don't like to jump on things that wobble, which is sometimes some of the reasons some of the cat trees aren't the most successful either, because they're not quite as stable as the cat would like, especially if they're a heavier cat or they're a very physically active cat. The force when they land on things can cause things to wobble, but you don't need to do anything super fancy really. I would move bits of equipment around as you've suggested, will do the trick. You could probably put some kind of shelf on the wall as well. So again, you've got an extra thing that they can jump up on to get over to. But part of it will just be looking to see what he's still able to do as he gets older as well, and then make those little adaptations as and when it's appropriate.
Yeah, and Ruth has said, is the pain management similar to that of dogs, i.e. Metacam, etc., a feline version of Librela? Any wonder drugs you can tell us about? We're slightly being a little bit naughty because I think we're going into the territory of some of the other talks that are later on.
I was about to say they're going to be covered. Yeah.
But maybe we can do a very, very quick 30-second summary rundown. But definitely, Ruth, listen into some of the other talks. In fact, let me try and have a little look.
I was about to say, I think you've got people like Sarah Caney speaking as well. So there'll be other people that can go into this a lot more in depth than I can. But yes, so non-steroidals, Metacam, Onzior are the kind of the big ones that we've had historically for long-term use in cats. And yes, we do have a feline version now of Librela, Silencia. I've been very happy with it with my cat. So in terms of analgesia, they're the main ones that we use. And then we sometimes use adjunct therapy as well. So sometimes things like gabapentin can be really useful as well. Really just comes back to the individual cat and what type of pain they're experiencing. And then we also, we will use some supplements. Fish oil type based ones, the omega-3s are the ones with the best evidence. So some of them are in diet, some of them are supplements that you can give. And then things like acupuncture, some vets do that, so that can be useful. So there is a whole range of things. Someone's just commenting about physio treatments as well. And again, I think that's an area that we're underutilizing. So if you're thinking about us, those sort of passive movements and flexions and extensions, if we can start to incorporate more of that in as well, that can be really, really helpful.
Yeah, I think probably people in the last 5-10 years or so, like the uptake for physiotherapy and acupuncture and things in dogs is increasing, but probably still, like you say, underutilized quite a lot in cats.
Yeah, it's interesting talking to colleagues that do acupuncture. They've anecdote again, in veterinary medicine we always lack decent studies, don't we? But anecdotally, at least, a lot of cats do exceedingly well on acupuncture, often better than many dogs. Physio, I think it comes down to the physiotherapist. Cats can be interesting patients, so some will do a lot better depending on the cat, but also depending on the skill of the physiotherapist and how good they are at reading cat body language and adapting and working with cats, because they can be a little bit trickier.
Yeah. Just to just very quickly run over when there are other lives this month, all to do with feline arthritis. There's one next Tuesday the 7th, and the following Tuesday the 14th, and Thursday the 16th, Thursday the 23rd, and Thursday the 30th. So 1, 2, 3, 4, 5, 6 in total, all on Tuesdays and Thursdays. So definitely worth listening in, because there will be other feline people talking all things arthritis. And I'm pretty sure, I can't remember which one, but there is one that will be more specifically to do with medications and things as well. So we can talk in more detail in those. But yes, many options, both sort of medical and non-medical, so things like acupuncture, physiotherapy.
And I think, we've talked about it already, but don't underestimate just adapting the home environment, because you can do a huge amount just by just adapting various pieces of furniture and providing things for your cat. That's really, really important.
Yeah. Karen's commented saying, you can give your cat some pain medications. Are there some natural ways for pain relief in OA cats? I think, again, like we've probably touched on it, like in terms of there are non-medical options such as acupuncture, physiotherapy, and like Natalie said, kind of adapting the home environment, which can make a massive impact on their sort of comfort levels and quality of life. And Karen sort of touched on like liver and kidney health. That's definitely something we keep an eye on. And again, I would probably say like chat to your vet about your individual cat, because there's certainly checks that can be done in terms of that, and making sure that you're always picking the right option or options for your cat.
Yeah, and remembering that things change and develop. There's a lot of these conditions are likely to increase, unfortunately, as they get older. Likewise, the arthritis is also likely to get more severe. And so what works for a period of their life, you may have to be changing and adapting to other things. So those regular assessments with the vet are really, really important.
Yeah, cool. Now, I'm just wondering if there's anything. I think we've pretty much covered everything that was on my list. Have you got anything to add, Natalie, that we've not covered?
No, I'm just having a quick look to see what I had on mine as well. I think I've covered most of the bits and bobs that I wrote down. I was just going to signpost to people. We have a fair amount of information on the International Cat Care website. So that's icatcare.org. And last year, as part of the celebrations of International Cat Day, we did do a little bit more of a focus on osteoarthritis in cats. So we do have a website page for that. That has some little infographics. They're mainly designed for our veterinary colleagues to be able to share through their social media, again, to raise awareness with their cat owners. But there's also some links on that page as well to some of the other more specific osteoarthritis sort of pages. And there's lots of advice and tips on there about home adaptation. And also, you know, if people have concerns and questions about medication, again, there's also advice on there as well.
Cool, great. So lots that people can have a look at. Hopefully those sort of links I've posted if people are seeing them in the comments section popping up. From my end, it looks like they should have done. So let me know, guys, if you're not seeing those links. So we've covered quite a lot. So the common signs of arthritis, how, you know, cats can be tricky to pick up on the signs. We have to look at kind of quite long-term changes, quite subtle changes. Definitely like owner observations at home are super, super important, as well as obviously what the vet can pick up at the time of an examination. But yeah, gradual changes over time, changes in behavior, jumping, sort of places maybe they used to be able to jump up onto and get down from, and now they're struggling. Changes in play, changes in their sleeping positions. So not quite.
I know what I did forget to mention was stairs. And how they go up and down the stairs is actually a really useful one as well. So again, young, fit, healthy cats will just go straight down and straight up. Older arthritic cats will often follow a bit of a pathway, a sort of zigzag up and down. And again, if you're concerned in collecting videos, if you have stairs in your house, they're really useful as well to be able to look for.
Yeah, that's a really good one. Yeah. Actually, one thing that I was thinking that perhaps we could discuss is, I know it comes up when we're talking about dogs. Owners kind of go, should I push for x-rays? Or is it kind of okay to go off all these changes that they're noticing at home and a clinical examination? Yeah,
that one it is a tricky one. It's definitely okay to do x-rays if we're going to go and do x-rays. So lameness in cats associated with osteoarthritis does occur, but it's because it's often symmetrical. They may be limping on one leg, but if you're suspicious that it's osteoarthritis, please x-ray both sides of the body and also x-ray the front and hind legs as well. So if you're going to do it, x-ray everything, because there may be one joint that's currently causing the most problems, but it gives you more information to see what is likely to be coming over the hill as well. From the veterinary side of things, a lot of us don't routinely x-ray these cases. It's an anaesthetic because you can't really get good x-rays consciously, so they have to be either heavily sedated or have an anaesthetic, which obviously has additional costs for the owner. However, a lot of these cats also have other things going on, like dental disease. So if I'm giving them an anaesthetic for the dental, I'll often do the x-rays at the same time. So that's quite a nice way of doing them. But a lot of us don't routinely x-ray these cases. We tend to only x-ray the odd ones. There was a nice study actually from Canada a few years back that again found similar over there as well, that only a small proportion of them were x-rayed. The vast majority, it was a combination of what the owner was seeing, what the vet was feeling, and often just a response to painkillers as well. So a little bit of a treatment trial. So they'd do a nice sort of treatment trial. The cat was suddenly jumping better and a lot more active and a lot happier. And so that almost made the diagnosis as well.
Yeah, cool. So I guess it basically, it depends. And like if it's, you know, if you're seeing those changes and the clinical exam is compatible with that, then it may not be necessary. But if there's anything a bit atypical, or, you know, you or the vet feel that it would be helpful, then it's definitely an option. But yeah not
definitely the ones that I would probably, having learnt from previous experiences, are some of the rescue cats, because we just often don't know what's gone on with them. And I had a situation once where I didn't x-ray, and I should have, because actually there was a pin going from a previous surgery that was also causing part of the problem that was occurring. So in those cases, they're the ones where we don't have maybe a decent long-term history for them. I'd probably lean toward x-raying those maybe a little bit more, but if they've been with the owner the whole life, then maybe less so of those ones as well.
Yeah. Somebody's asked, can cats get arthritis in the gums?
Not in the gums as such. So the teeth, it's not a joint as such, but we can get arthritis in the temporomandibular joint. And so that's the joint that affects how well the cat can open its mouth and can chew. And so that can be especially painful and obviously have quite a big impact. I don't know if it's truly arthritis, or it's just degenerative joint disease. But basically, it's a joint disease that's painful. So we do see that, unfortunately, with both cats and I assume probably dogs as well.
I would say, especially if they've ever had a road traffic accident in their life, because we do see, like, commonly, unfortunately, cats, you know, they will get hit and sort of slam and cause trauma or dislocation to the jaw. So that's something which would always be on my radar as well, if they've had a previous trauma like that.
No, definitely. Yeah, it is something that we need to be taking into consideration, especially with these ones where their appetite's been quite significantly affected. And you can imagine if it's sore to eat, you're not going to eat as much, are you? So, yeah.
No. Nikita has asked, is there any way we can contact you guys if we have any further questions? And she's doing a mini lit review involving feline OA, which sounds very interesting. And it would be great to get some more resources and professional opinions. So definitely try and tune in to the other lives later this month if you can. I'll just run through the dates again. So we've got next Tuesday the 7th, Tuesday the 14th, Thursday the 16th, Thursday the 23rd, and Thursday the 30th. So once you've listened to all 6 of those, that will be very helpful. And via our Facebook pages as well, you can get in touch, ask questions. There's monthly tea and chats, usually with Hannah Capon, who is the canine arthritis management queen, and she's also a vet, and she can answer questions on there as well. If you've got any like random ones that haven't been covered, then that's a good opportunity to ask those. That's more of like a not as like set topics, just like come along, ask your questions kind of thing. If you are a member, which is a £25 fee to become a member for the whole year, you will have access to every single live that there has ever been. Granted, most of them are about dogs, but we're branching out into cats. And maybe one day in the pipeline is sort of FAM, feline arthritis management, instead of CAM. So again, look out for possible FAM developments in the future as well. But yeah, basically reach out any way you like, mainly through the social media, and some lovely person will get back to you.
I was just going to add to that, the journal that we produce as part of the charity that I work with, we produce a journal called the Journal of Feline Medicine and Surgery, and it became an open access journal in January. Obviously, it's written a peer-reviewed journal for the veterinary audience, but there's a number of review articles about feline osteoarthritis, feline chronic pain in that as well. So they are available for people to read. Obviously, obviously they're written for veterinary professionals, but there's potentially some useful information in some of those articles as well. So the Journal of Feline Medicine and Surgery website, you can just access that, anyone can, and read the whole back catalogue from the last 20 odd years, which you probably don't want to, because I haven't done that yet.
Despite spending many years of your life studying these.
Yeah, still haven't read all of it. I've read a lot of the old cat stuff, at least.
Oh, somebody just said, which journal? I'll just type in the box. Journal of Feline Medicine, right?
Medicine and Surgery, yep.
Feline Medicine.
Yeah, there is a review article that I wrote for 2020 on feline age-related feline musculoskeletal disease, which covers some of the things that we've talked about tonight. But yeah, it's definitely for a veterinary audience in that sense.
But if you want the proper hardcore science, like evidence-based, peer-reviewed situation, then
all of the references, there's a lot in there.
Yeah, cool, lovely. Right, well, I think that is everything, and we're exactly on an hour, literally. So I think we have covered everything. I would like to say thank you very much to our sponsor, who is Big Barker Beds. Again, I believe that it's for dogs, but a cat, I'm sure, would enjoy a lovely big orthopedic dog bed. So it doesn't just. I was
going to say, cats are very good at stealing dogs' beds. So
yeah. So thank you, Big Barker Beds, and thanks very much for tuning in, guys. And yeah, we look forward to the rest of Feline Month. And thank you so much to Nathalie for giving up her time. She is an absolute guru of all things feline medicine, especially old cats. So the perfect person to chat to. And we hope to see you guys for some more talks later in the month.
Great. Thanks, everyone. It was really fun.
Cool. Thanks, guys. Bye.